Did you know that every year, around 240,000 Americans experience a mini-stroke, also known as a TIA, Transient Ischemic Attack? These episodes are often dismissed because their symptoms are brief and seem to pass without lasting harm. But don't be fooled. These transient ischemic attacks are anything but harmless. Studies reveal that 1 in 5 people who experience a TIA will suffer a major stroke within 90 days, and older individuals are particularly at risk. Think of a TIA as your body's urgent warning, a red flag signaling serious trouble ahead. Recognizing these signs early and acting quickly could literally save your life. The problem? These fleeting symptoms are often easy to ignore or misdiagnose. That's why it's so important to stay informed, especially if you or a loved one is in their later years. In this video, we'll explore how recognizing these warning signs can help prevent a life-altering stroke and what steps you can take to protect yourself or someone you care about. What is a mini-stroke TIA? A mini-stroke, or Transient Ischemic Attack, a TIA, is a temporary interruption of blood flow to the brain. Think of it as a small-scale warning. A blockage briefly cuts off oxygen, but the effects usually resolve within minutes to hours, leaving no lasting damage. Here's how a TIA differs from a full-blown stroke. A stroke causes long-term brain damage, often leading to severe disability or even death. A TIA doesn't cause permanent damage, yet. It's a warning that a major stroke could be imminent. Studies show that TIAs are most common among older adults, with approximately 15% of individuals over 65 experiencing one at some point in their lives. Recognizing a TIA as a critical warning and seeking medical attention immediately could be the key to preventing a more severe, life-altering stroke. Why recognizing mini-strokes is crucial. Understanding and recognizing the signs of a mini-stroke, TIA, is absolutely essential because it's often a precursor to a major stroke. Research shows that about 1 in 3 people who experience a TIA will go on to have a full-blown stroke, and nearly half of these occur within the first 2 days after the TIA. A major stroke can lead to severe neurological damage, permanent disabilities such as paralysis or loss of speech. In the worst cases, even death. However, there's good news. Catching a TIA early gives doctors the chance to intervene and significantly lower the risk of a larger stroke. Treatments like medications, lifestyle changes, or specific medical procedures can help prevent long-term complications and preserve your quality of life. Ignoring the symptoms of a TIA is a missed opportunity to address a serious problem before it escalates. Acting quickly and taking the warning signs seriously could be the difference between life as you know it and a future altered by stroke-related disabilities. The 8 warning signs of mini-strokes in the elderly one. Sudden weakness or numbness. One of the most common warning signs of a mini-stroke is sudden weakness or numbness, often on one side of the body. This can affect the face, an arm, or a leg. You might notice a drooping mouth, an arm that feels heavy and difficult to lift, a tingling sensation in the leg. These symptoms typically last for just a few minutes to an hour, but even if they resolve quickly, they shouldn't be ignored. Why does this happen? A TIA occurs when a blood vessel temporarily becomes blocked or narrowed, reducing the oxygen supply to a specific part of the brain. If the affected area controls motor functions or sensation on one side of your body, you'll experience these sudden symptoms. The good news? Blood flow is usually restored before permanent damage occurs. However, this is a serious red flag that a larger stroke could be on the way. Recognizing and acting on this warning sign could make all the difference in preventing severe, long-term complications. 2. Temporary vision changes. Another warning sign of a mini-stroke is sudden vision changes, which might include blurriness, double vision, temporary blindness in one or both eyes. One specific condition linked to mini-strokes is amaurosis fugax, a temporary loss of vision, typically in one eye. People often describe it as a curtain or shadow falling over their vision, lasting a few seconds or minutes before resolving. Why does this happen? Mini strokes disrupt blood flow to the brain or the areas responsible for vision, including the retina. This lack of oxygen and nutrients causes the vision changes, which are a warning that a major stroke could be imminent. If you or someone you know notices sudden changes in vision, don't dismiss it as fatigue or eye strain. These symptoms are your body's way of alerting you to a serious issue. Seek medical attention immediately, as addressing the problem early could prevent a life-threatening or disabling stroke. Third, difficulty speaking or slurred speech. One of the more alarming warning signs of a mini stroke is difficulty speaking or slurred speech. This can manifest as trouble forming words, speaking in a garbled or slurred manner, difficulty understanding what others are saying. You might feel as though the words are on the tip of your tongue, but they come out jumbled or incoherent. Mini strokes can disrupt blood flow to the areas of the brain responsible for speech and comprehension, leading to a temporary condition called aphasia. Even a brief interruption in these regions can result in difficulty communicating clearly. What should you do? Symptoms like slurred speech or trouble understanding others are often dismissed as stress or fatigue, but they should never be ignored. Act immediately. Seek medical attention if you or someone you know experiences this symptom. Early intervention can help prevent a larger stroke that could cause permanent damage to your ability to speak or understand language. 4. Sudden confusion. Sudden confusion is a warning sign of a mini stroke that can often be mistaken for other conditions, such as fatigue, stress, or even early signs of dementia. This confusion may present as difficulty concentrating, disorientation or mental fog, trouble remembering simple things. Why does this happen? A mini stroke disrupts blood flow to the areas of the brain responsible for memory, thinking, and problem solving. Unlike dementia, which develops gradually, the confusion caused by a TIA is abrupt and temporary. What's the risk? Unfortunately, sudden confusion is often dismissed in elderly individuals as part of the aging process, delaying critical medical attention. What should you do? If confusion arises suddenly, don't second-guess it. Seek medical help immediately to protect brain health and prevent permanent cognitive damage. Recognizing this symptom as a potential TIA can make all the difference in preventing a more severe stroke. 5. Dizziness or loss of balance. Dizziness, or a sudden loss of balance, is another key warning sign of a mini stroke. You might feel lightheaded or like the room is spinning, unsteady on your feet, leading to unexpected falls. Why does this happen? While dizziness can result from dehydration, low blood sugar, or inner ear conditions like vertigo, TIA-related dizziness stems from disrupted blood flow to the brain areas responsible for coordination and balance. Key differences to note: TIA-related dizziness often appears suddenly and may accompany other symptoms like numbness, vision changes, or difficulty speaking. It doesn't resolve with common remedies for dizziness. What should you do? If you or someone you know experiences sudden dizziness or balance problems, especially alongside other symptoms, seek medical attention immediately. Acting quickly can help prevent a serious stroke and its long-term consequences. 6. Severe headaches. While not the most common symptom of a mini stroke, severe headaches can occur, especially if there is vascular stress or a sudden change in blood flow within the brain. How do these headaches feel? They come on quickly and feel different from typical headaches. They're often described as sharp, intense, or unusual. Why does this happen? During a TIA, a temporary blockage in a blood vessel may cause changes in pressure or irritation in the brain's blood vessels. While mini strokes don't usually cause permanent damage, this vascular stress can lead to sudden, unexplained headaches. What sets them apart? Unlike regular headaches, TIA-related headaches often come with dizziness, vision changes, slurred speech, numbness. What should you do? If an elderly individual experiences a sudden, severe headache, especially alongside other neurological symptoms, it's crucial to seek immediate medical attention. These headaches should never be dismissed as just a headache. Early intervention could prevent a larger stroke or serious complications. 7. Brief loss of consciousness. Fainting or a sudden feeling of extreme drowsiness can also be a warning sign of a mini-stroke. These episodes are often dismissed as minor issues, but they may indicate a temporary disruption of blood flow to the brain. What causes this? The brain relies on a constant, steady supply of oxygen and nutrients from the blood. During a TIA, a temporary blockage or narrowing of blood vessels interrupts this flow, leading to lightheadedness, weakness, complete loss of consciousness. Why is this concerning? While these symptoms might pass quickly, they are a critical red flag indicating that your brain isn't receiving adequate circulation. What should you do? Don't dismiss fainting or sudden drowsiness as nothing serious. Seek immediate medical attention to address the underlying cause and prevent a full-blown stroke. Ignoring these symptoms could lead to permanent consequences, but timely action can save a life. 8. Tingling sensations. A sudden pins and needles feeling in one side of the body is another warning sign of a mini-stroke. This tingling can affect an arm, a leg, the face. Why does this happen? Unlike a pinched nerve or awkward sleeping position, which physically compresses the nerves, a TIA causes tingling due to a temporary disruption in blood flow to the nerves controlling sensation. Key differences to watch for. TIA-related tingling comes on suddenly and may appear alongside other symptoms, such as dizziness, vision changes, or slurred speech. What should you do? If you experience sudden, unexplained tingling, especially on one side of your body, don't brush it off. It could be a critical warning of a larger stroke to come. Seek medical attention immediately. Risk factors for mini-strokes in the elderly. Mini-strokes, or TIAs, don't happen randomly. They are often caused by underlying health conditions or lifestyle factors that increase stroke risk. Understanding these factors can help you or your loved ones stay vigilant and proactive. Key risk factors include high blood pressure. This is one of the leading causes of mini-strokes. It puts excessive strain on blood vessels, making blockages or narrowing more likely. Diabetes. Diabetes damages blood vessels and disrupts blood flow to the brain, significantly raising the risk of a TIA. Atrial fibrillation, AFib. Irregular heartbeats can cause blood clots to form and travel to the brain, leading to a mini-stroke. Other heart conditions, heart diseases such as coronary artery disease or heart failure, further elevate stroke risks. Lifestyle factors play a critical role. Smoking damages blood vessels and increases the risk of clotting. Obesity and sedentary lifestyle. Poor cardiovascular health due to inactivity or excess weight creates ideal conditions for mini-strokes. Why time is critical. Mini-strokes are your body's early warning system. Acting within the golden hour, the first 60 minutes, significantly increases the chance of preventing long-term damage. How to act quickly. Use the FAST method to assess symptoms. F. Check the face for drooping. A. Test if one arm feels weak or numb. S. Listen for slurred speech or difficulty speaking. T. Take note of the time symptoms began and seek emergency help immediately. Diagnostic tools. Once medical care is sought, tests such as MRIs, CT scans, or carotid ultrasounds can help doctors identify blockages or damaged blood vessels, allowing for timely treatment to prevent a major stroke. Treatment options and prevention strategies for mini-strokes. If you or someone you know has experienced a mini-stroke or is at risk, taking action promptly is essential to prevent a more severe stroke. Fortunately, there are effective treatments and prevention strategies available. Medications. Doctors often prescribe antiplatelet drugs, e.g. aspirin, prevent blood cells from clumping together and forming clots. Anticoagulants, blood thinners, recommended for conditions like atrial fibrillation to reduce clotting risks. Lifestyle modifications are equally important. Heart-healthy diet. Focus on fruits, vegetables, whole grains, and healthy fats. Reduce cholesterol and improve vascular health with nutrient-dense foods. Exercise. Engage in regular physical activity like walking, yoga, or light strength training. Exercise helps maintain a healthy weight, lowers blood pressure, and improves circulation. Quit smoking. Smoking damages blood vessels and accelerates clotting risks. Quitting is a critical step in prevention. Limit alcohol. Excessive drinking increases the risk of TIAs and strokes. Moderation is key. Manage underlying conditions. Consistently monitor and control hypertension, diabetes, and high cholesterol. Work closely with your healthcare provider to tailor a prevention plan suited to your needs. Why prevention matters. Taking these steps is not just about avoiding problems, it's about protecting long-term brain and heart health. Every proactive choice reduces the risk of a severe stroke and improves overall quality of life. How families can support elderly loved ones. Supporting an elderly loved one who is at risk of or recovering from a mini-stroke, TIA, requires awareness, encouragement, and care. Families play an essential role in ensuring their loved ones stay safe and healthy. 1. Recognize the symptoms. Often, elderly individuals may not be fully aware of the subtle signs of a mini-stroke. As a family member, it's important to watch for symptoms like slurred speech, sudden confusion, or numbness. Act quickly if you notice any of these signs. Call for emergency medical assistance without delay. 2. Encourage routine checkups. Regular visits to the doctor can help monitor risk factors such as high blood pressure, cholesterol levels, diabetes management. Frequent checkups ensure that any issues are addressed early and reduce the chances of a future stroke. Support healthy habits. Adopting a healthy lifestyle can feel overwhelming for elderly individuals. Families can help by preparing nutritious meals together that align with a heart-healthy diet, encouraging light physical activity like going for walks or doing simple stretches, providing emotional support to make these changes more enjoyable and sustainable. 4th, offer emotional and logistical support. Recovering from or managing the risks of a mini-stroke can be stressful. As a caregiver, you can help with transportation to medical appointments, remind them to take medications as prescribed, be a source of reassurance during a potentially frightening time. Why your support matters. Your presence, patience, and understanding can aid in their physical recovery, build their confidence to prioritize their health, reduce the emotional burden of managing a serious condition alone. By staying engaged and proactive, you can make a significant difference in the well-being of your loved ones. The bottom line, mini-strokes, or TIAs, are not minor. They are critical warning signs of a potential major stroke. While the symptoms may seem brief or harmless, they are your body's way of signaling an urgent problem that requires immediate attention. Key takeaways. Recognize the signs early. Symptoms like numbness, vision changes, or slurred speech are not to be ignored. Take action promptly. Seeking medical attention can prevent long-term complications. Adopt preventive strategies, including a healthy diet, exercise, and managing chronic conditions. Why this matters. Awareness and timely action can save lives. By knowing the symptoms, risk factors, and preventive measures, you can protect yourself or your loved ones from the devastating effects of a full-blown stroke. Together, we can turn awareness into action and ensure a healthier, longer life for everyone. Stay informed, stay proactive, and remember, every step toward prevention makes a difference.